I've been a naturopathic doctor since 1995. I graduated from the National College of Naturopathic Medicine and sat board exams and started to work as a naturopathic doctor in Canada in September of 1995. I pursued naturopathic medicine for several reasons. One is because I've got an active mind and I like to know things. I ask a lot of questions of myself, of the world, and naturopathic medicine has got an education program that allows me to know the why. Why do people get sick? Why do they get well? That was very important to me.
My symptoms that brought me to Dr. Wikenheiser were back pain. I had lower back pain, which was getting to the point of being debilitating. I could hardly sit all day at work. I liked to be active and I couldn't be active anymore, and I was in pain probably 75% of the time, if not more.
My knee was causing me a lot of problems. I've had 2 scopes on my right knee, and then it got so bad I was having knee pain in both knees, and I would continue to play sports, but I was suffering a lot and so I knew I had to see a specialist to see what was going on. So my doctor referred me to an orthopedic surgeon. I had my x-rays and I waited about 6 months to finally get in and see the orthopedic surgeon. He showed me my x-rays, and I have bone on both knees. My medial meniscus is totally gone. And he told me that I needed 2 knee replacements. So I was going to require surgery. So when I left his office, I was reluctant to have surgery. I've heard some bad things about surgery, and right just before that, I had seen an article that Dr. David Wikenheiser had in the local Capital News newspaper, and it was titled "How to Avoid Knee Surgery."
My practice is different because I'm different from many of the other practitioners. Everyone runs their office and offers beyond what we got in school, beyond what we've done for extra training outside of school, what is their personal approach. And I treat patients the way I want to be treated, which I give a lot more information. I take time, I plan it in the schedule to discuss with the patient why they've gotten sick, what was their process, and how to get better. I believe that when someone knows how they got into trouble, that they can get out of trouble as well.
I feel fabulous. I feel I'm pretty much pain-free. I'm even riding my bike, which I could not do before, and that was one of the things I could not do. So yeah, it's been very good.
I no longer need knee surgery, in my opinion. I immediately after my first treatment, which involved basically some needles in my knee, and it was painless, and I had immediate relief, and I required 3 treatments 1 week apart, and I've had fantastic results. I was prepared to give up sports as long as I could walk pain-free. Well, it's far beyond my expectations. I immediately resumed all my sports and pain-free, so I'm very pleased with the results.
I incorporate a number of therapies in my clinic to help people with the basics. So there are several basics to good health. You need to feed the body. So we're looking at different types of tests to evaluate nutrition, to advise what type of diet to take, what type of supplements to add into the body. Beyond that, we look at toxic load. Are they toxic from the standpoint of toxic metals and other toxins in their body? And from there, we're looking at testing for energetic balance. There's sensitivity testing for food allergies. Beyond that, we're looking at standard medical tests for blood tests, for hormones. There's even cancer tests for hormones within the human body to find out 5 to 10 years ahead of time if they're in trouble. So these are very innovative, very useful and effective tools for evaluating the body, and then we use a whole bunch of different therapies, including nutrition, detoxification, energetic balancing, that will help that person go back into a balanced state and resolve their health issues. My motivation to come to work every day is the joy I get from helping people. Now, I see people right from the day that they come in with a problem through them possibly getting worse before they get better, In some therapies, some of the joint therapies, we may aggravate a joint for 3 to 4 days before they start getting better. So I look after people through that whole continuum. And the reason why I come in is because of the personal joy I get from helping people. It's a thrill. And I like that. And that's why I do it. You know, beyond anything else, beyond the needs of society, beyond the needs for money, for paying bills, for getting recognition. All of that's nice, all of that's necessary for a business, but what turns me on is getting results. When people are out of pain, when they no longer have bowel issues, when they no longer have emotional issues, when their hormones are balanced, when their allergies are better, whatever they came in for, when they're better, that's when I get a thrill.
Yes, I would definitely refer Dr. Wikenheiser, and I have referred him to my family members.